day to all my dear students, OET parents, all my dear students who are watching me. So this is our 50th live session on this virtual platform, B-GHUD Academy, OET Speaking. Okay, അപ്പോൾ നമ്മുടെ 50ാമത്തെ OET Speaking വീഡിയോ ആയിട്ടാണ് നമ്മൾ വന്നിരിക്കുന്നത്. നമ്മുടെ ലൈവ് പ്ലാറ്റ്ഫോമിൽ ഇത് 50 ആഴ്ചയായി, 50th വീക്കാണ് നമ്മളിപ്പോൾ. നമ്മുടെ ഒരു ഗോൾഡൻ സെലിബ്രേഷൻ എന്നൊക്കെ വേണമെങ്കിൽ പറയാം. Okay, so thank you all for your support. Thank you for supporting me. Thank you for encouraging me for doing these sessions without any hindrance. Okay, അപ്പോൾ നമുക്ക് നമ്മുടെ ഇതിനകത്തേക്ക് റോൾ പ്ലേക്കകത്തേക്ക് കിടക്കാം. Now we are stepping into our role play. Okay, so we don't have to waste time. So it's me once again, Abhilash Vijaymohan, the senior faculty from B-GHUD Academy. Okay, അപ്പോൾ ഇതൊക്കെ അറിയാവുന്ന കാര്യങ്ങളാണ്. എന്നിട്ട് എന്താണ് ഒരു ഗുമ്മിന് വേണ്ടിയിട്ട് നമ്മൾ അങ്ങ് പറഞ്ഞുകൊണ്ടിരിക്കുകയാണ്. Yes, so now the question will be displayed right there. We'll have a quick look on the question and we will move into the discussion. Okay, so these all are exclusively exam related topics. Okay, these all are exam related topics. I want all of you to go through this practice, just learn how to answer the question. So what the action and reaction of an examiner would be, how to react, how to act, all those things you can learn from this live platform session. Okay, fine. So welcome once again. Please have a quick look and reference to this question displayed over there. Fine. Yes, the setting given is a hospital ward. You see a 40-year-old patient who had a urinary catheter inserted following a hernia repair. Okay, the catheter removed 6 hours ago. You are monitoring bladder function. Find out how the patient is feeling, any pain, whether passed urine and all. Okay, yes, so this is a known, there is no doubt about it. This is a known case. Okay. This is a 40-year-old patient. A urinary catheter has been inserted following a hernia repair surgery. Okay. Now the catheter removed 6 hours ago. We are monitoring the bladder function. Okay. Now we are monitoring the bladder function. Catheter was removed 6 hours ago. Fine. Yes. Find out how the patient is feeling. So it's a known case. There is no doubt about it. Collect the name and start with the conversation. Inquire their general well-being, ask how they are feeling, any pain or passed urine, find out more details about the pain. Okay, so we need to collect more details like onset, treatment tried and all. Explore the patient's hydration. Hydration means the intake of water we should ask, like quantity. Okay, yes, the quantity of drink and last time. Okay. Explain the purpose of trial without catheter. So we need to explain. We were checking, we are having a trial like ensure bladder function restored. Okay, so we need to explain why we have removed this catheter, because this was a trial. We are seeing whether the patient is able to void or the patient is able to pass urine. Okay, we are seeing their bladder function and trial failure. Okay, unfortunately, the trial is a failure. No urine for past 6 hours. Okay, outline next steps. We need to inform that also trial is a failure and we need to inform them the next steps like a reinsertion of catheter, discharge with catheter, retrial 1 week. Okay, so reinsertion is needed, discharge is possible, retrial will be there after 1 week, even after discharge. Okay, warn the patient of possible risk of not reinserting the catheter. So finally, the patient would be having some hesitance or reluctance in going for again for a catheter. They may reluctant, they may be very reluctant. Patient would be very reluctant. So, but we need to make them sure. We need to ensure that why there is need of inserting the catheter. Like if it is not inserted, there could be urine retention and infection can occur. Fine. Give details of catheter management. So we need to ask about the catheter management to inform them. Like it's very easy to empty catheter bag. Community support can be available. Okay, so they can seek community nursing service too. Establish patient consent for catheter reinsertion. So finally, after convincing, after making them aware about all these consequences of not reinserting, the benefits of inserting, we need to seek their permission. We need to convince them. Okay, to for catheter reinsertion. Fine. Next, inform the patient of time scale for returning to hospital. So when to come back to hospital? Again, we need to inform them like within 1 week to remove the catheter. So reinsertion will be there. They can go home after 1 week. Again, they should come. There will be again a trial. Okay, then repeat the trial without catheter. So again, we will be at that time after 1 week. We'll be repeating one more trial. Okay, and advice to return sooner if worried. But we can ask them not to wait in case if they have got some worries or concerns. In case if they have got some worries or concerns, we can ask them not to delay, or we can ask them not to wait for 1 week. They can come in between. Fine, like in case of increasing pain or other discomforts, if they notice anything like that, they can come to our hospital for seeking medical support. Fine. Yes. So that's all about the question. This was an examination question. You can prepare and you can go for this. Just have one more look onto this question. In case of any queries or concerns, please do put your suggestions in the comment box. I'm ready to help you. Okay. I think there are no concerns related to the question. So, okay. The question sounds, the question is quite bulky. There is a heavy, the question is very heavy, the multitask question. So many task hints and points are given there. So you should organize your time. It's a very your skill is like punctual with your time. You need to organize your time because it will take more than 5 minutes if you go for an elaboration, but you cannot even miss any task too. At the same time, you need to cover the whole task, but make sure that judicious and cautious use of time is done. Okay. Okay. So if you don't have any queries or concerns, let's move into the discussion session. So we'll take the dialogues, we'll present how the patient would be acting and how the uh, interlocutor should react or the nurse should react. Okay. Yes. So I told this is a non case. We can collect the name during the 3 minutes of preparation and we can go for patient's addressing. Good morning. Hello. Good morning, Mr. Martin. Universal name of mine is like I am saying that. Hello. Good morning, Mr. Martin. I'm your nurse here today. You can say your name because they are known to each other. I'm your nurse here today. How are you feeling? How are you doing? Is everything going on well? Okay. Is everything going on well? Okay. How's the pain? Do you have any pain? Do you have any pain? Have you passed urine? Have you passed urine? Okay. Have you passed urine since the removal of catheter? So you can just tell, hello, hello, good morning, Mr. Martin. I'm your nurse here. How are you doing? How are you feeling? I'm here for your care. How are you doing? How are you feeling? Okay, is everything going on well? How is the pain? Do you have any pain? Or and you can have you passed urine since the removal of catheter? Have you passed urine since the removal of catheter? So they will be saying, they will be answering to all those things like pain is there, all those things. Okay, fine. I'm sorry. We can say like, I'm sorry. It's that's terrible. Okay, having pain, that's terrible. I am sorry. Having pain, that's terrible. You please don't worry. You please don't worry. Please tell me when did it start? Please tell me when did it start? You don't worry. You don't worry. Please tell me when did it start? Okay. When did it start? Okay. Did you try any treatments? I mean, any home remedy or any supportive therapies or any medications? Have you tried? Have you tried any treatment? I mean, any medications or any other complementary therapies? Have you tried any treatment? Okay, I mean, medication or complementary therapies? Okay, so they will be seeing all those things. Tell me about your fluid intake. Okay, now tell me about your fluid intake. Okay, how many glasses of water did you have? Okay, what is the quantity of water did you have? Okay, tell me the quantity of water you had, or how many glasses of water did you have? Okay, how many glasses of water did you have? So they will be giving you the exact count of number of glasses of water they had. Okay, when was the last Okay, so we are asking about last drink. When was the last drink? Okay, when was the last drink? So they will be also saying all those things. When was the last drink? They will be giving you answers for all those things. Thank you, Martin, for answering. We removed your catheter. Okay, it's in 6 hours. It's 6 hours since your catheter have been removed. Since your catheter has been removed. Okay, it's in 6 hours. You are out of catheter. It's in 6 hours. You are out of catheter. This was a trial. This was a trial. Okay. We were saying whether you had restored your bladder function. We were saying your bladder function. We were saying your bladder function. Okay. So we were seeing whether your bladder function was restored. Okay. Unfortunately, the trial is a failure. So that is how you should. So this was a trial. We are seeing whether you had restored your bladder function. This was a trial. We were seeing whether you have restored your bladder function. Okay, whether you have restored your bladder function. Unfortunately, okay, so we are just informing the patient. See, this was a trial. Okay, you are out of catheter for past 6 hours. We were seeing whether you have restored your bladder function. Unfortunately, Martin, this trial is a failure. There is no urine for past 6 hours. There is no, unfortunately, Mr. Martin, this trial is a failure. So you have to put that tone in your voice. Okay, you have to give the tone in your voice. Like, unfortunately, the trial is a failure. Unfortunately, the trial is a failure. Okay, I'm sorry. Unfortunately, the trial is a failure. I'm sorry. There is no urine output for past 6 hours. There is no urine output for past 6 hours. Okay, there is no urine output for past 6 hours. So they'll be saying like, oh no, what you are saying, nurse, what I will do now. Please relax. Please relax. Don't be anxious. There are some measures that we need to do. There are some measures that we need to do. So they'll be saying like, what is that, nurse? So the definitive management now is reinsertion of catheter. The definitive management now was reinsertion of catheter. The definitive management now was reinsertion of catheter. The definitive management now is reinsertion of catheter. Reinsertion of catheter. The nurse, what you're saying, nurse? I want to go home, nurse. I'm more concerned. Should I have to stay here for more time? No, not at all. There is no need of any stay here. There is no need of continuing stay at hospital. You can definitely take your discharge. You can definitely take your discharge with this catheter. You will be sent home. Okay, with this catheter bag, with this Euro bag or catheter bag, you will be sent to home. You will be sent to home. Okay, but there will be again a trial. But again, there will be a trial. But there will be a repeat trial. But again, there will be a repeat trial after 1 week. Okay, but again, you have to come here after 1 week to repeat the trial. But again, you have to come here after 1 week to repeat the trial. Okay, so that we could see whether the bladder function was restored or not. Understand? Understand, Parim? Oh no, sir, I don't feel like you. Please give me some other remedials. I don't want this catheter to be reinserted. I'm really okay. So they will be saying all those things. I don't want this catheter to be reinserted. Just do some other measures. I understand that's terrible having this catheter. I understand having a catheter that's quite terrible. I understand, but there are no other options now. Okay, but there are no other options now. There are no other options now. Okay, the definitive management available is catheter reinsertion to facilitate urine output. The definitive management now available is reinsertion of catheter uh, to restore the bladder function, to maintain the urine output, or to facilitate urine output. Okay, in case if it is not reinserted, in case if it is not reinserted, in case if it is not reinserted, there can be accumulation of there can be retention of urine. Okay, in case if it is not reinserted, there can be retention, accumulation or retention of urine in the bladder, and it may result in infection. And it may result in infection. And it may result in infection. That can be very serious. That can be very serious. Are you getting me? Are you getting me? So the patient will be saying like, oh nurse, so I understand what you're saying, nurse, but the thing is like, I really don't know after going home what to do. Uh, After going home, I know you're very concerned regarding catheter bag management, Euro bag management. I know you're very concerned regarding your catheter care afterwards, after your discharge. I know you're very concerned regarding your catheter care afterwards or after discharge. You don't have to worry. I will inform you how to manage this catheter. Okay, I will inform you how to manage catheter at home. Okay, it is very easy. We will teach you on how empty the bag. Okay, we'll teach you how to empty the bag, and also make you aware regarding the hygienic activities that should be done, and also will make you aware regarding the hygienic activities that should be done at the catheter site. That should be done at the catheter site. Okay, if you're more concerned, I could arrange community nurse visit to you. I could arrange community nurse visit to you. They'll come to you and will make, okay, they will come to you and let you learn more about catheter management and care. They will come to you and will let you know more about catheter care and management. Okay, they will let you know more about catheter care and management. Does that sound okay? Okay. Does that sound okay? Okay. Does that sound okay? So the patient would be saying like, oh, yes, nurse, that's great. I feel like I should go for that, nurse. That's great. So the patient would be saying, definitely, I will do the needful. You don't have to worry. Definitely, I will do the needful. You don't have to worry. Okay. All right. I hope you're confident now. I hope you are confident now. I hope you are confident now. Okay. Do you have any other concerns or queries to discuss with me? Do you have any other queries or concerns to discuss with me? Do you have any other queries or concerns to discuss with me? Please feel free to ask. Please feel free to ask. So the patient would be saying like, I don't have any other doubts, nurse. Um, okay. So what do you say? Are you ready to get the catheter reinserted? Okay. So what do you say? Now what? So now what do you say? Are you ready to get the catheter reinserted? Are you ready to get the catheter reinserted? Are you ready to get the catheter reinserted? So they will be saying like, yes, nurse, I'm ready. You can do that. Great. Glad that you agree. Great. Glad that you agree. Thank you for your patient listening and understanding. Great. Glad that you agree. Thank you for your patient listening and understanding. Okay. As I told, the catheter will be reinserted. After the doctor's visit, the catheter will be reinserted. After the doctor's visit, the catheter will be reinserted. You can go home, you can take the discharge and can go back home. You can take the discharge and go back home. You can take the discharge and go back home. But in case if you experience something unusual, okay, but in case if you experience something unusual, you can come. Otherwise, you have to again, you have to be here again after 1 week. You have to be again here after 1 week. You have to be again here after 1 week. Okay, you have to be again here after 1 week, again here after 1 week to repeat the trial. You have to be again here after 1 week to repeat the trial. Okay, so we'll see at that time if there is enough if there is urine output, then if there is enough urine output, then definitely you will be freed of catheter. Okay, you will be freed from catheter. Okay, you'll be freed of catheter. Yes. Okay, so that is how we should convince the patient. Okay, you'll be freed of catheter. You will be freed of catheter. That's what. If there is enough urine output, you will be freed from catheter. Okay, will be the catheter will be removed, or you will be freed of catheter. Fine. So they will be agreeing to your no, so, okay, no, that's fine. Okay, and in case if you experience something unusual or unpleasant, and don't delay. In case if you experience something unusual or unpleasant, in case if you experience something unusual or unpleasant, I mean any pain. Okay, I mean any pain or other discomfort. In case if you experience something in unusual like any pain, abdominal pain, discomfort. Okay, anything if it is disturbing you, never delay. Get back to us as early as possible. Like get back to us as early as possible. Get back to us as early as possible. Okay, so get back to us as early as possible. Are you getting me? Okay, so now there is nothing to be overly concerned about. So now there is nothing to be overly concerned about. So there is nothing to be. So now there is nothing to be overly concerned about. Okay, please stick on to the instructions as advised. Okay, be in touch with the treatment plan. Okay, so get in touch with the treatment plan. Okay, stick on to the instructions outlined. Definitely that will do a great help. 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 It will definitely accelerate your recovery. It will definitely accelerate your recovery. I hope you are understanding. I hope you are following. Okay. Any other queries or concerns for me? Any other queries or concerns for me? Is there anything else that you would like to ask or discuss? Is there anything else that you would like to ask or discuss? Hope I have assuaged all your queries. Simply, we are just trying all these things. Hope I have assuaged all your queries. Hope I have assuaged all your queries. Okay. In case of any queries, feel free to ask. Your discharge intimation will be given later. Okay, your discharge intimation will be given later. Now relax, take rest. Now relax, take rest. Now relax, take rest. Okay, now relax, take rest. Like that, if the patient is an admitted case, we are just asking the patient to continue. We have just alleviated or we have just addressed all their concerns. Okay, so there is nothing in excess. I hope the discussion is clear to one and all so far. Any queries, concerns, or comments means you can pin it in the comment box. You can send the questions through mail or to our quality control people will be always ready to receive your doubts. Okay, your questions you can send to us. And definitely we'll consider that and we'll make you learn whatever the question would be, make you learn how to deal with different role plays and topics. So this was also a classic examination question. I want all of you to go through this, read well, practice well. Okay, so with more practice, the more practice, more mellifluous will be a speaking. Okay. So this was our 50th live platform session. Now it has come to an end. Stay tuned. Uh, Stay online. Stay tuned. Okay. Share it with people who are in need. Okay, can share these classes with support, your encouragement, and for all those things. So my prayers and wishes to all my dear students. Um, by next year, this time, may God Almighty shower His blessings upon you to be there in your dream destinations. Okay, work for that. And whatever the questions that you're having in doubt, please send to me. We are all the time. We are here to help. Okay, so this topic is clear to all. Read well, practice well. So see you for the 51 by next Friday. Till then, take care. God bless you all. It's me, Abhilakshmi, and I am signing off. God bless.